Antibiotic resistance or antimicrobial resistance is the situation where commonly used antibiotics are no longer very useful or are less useful in treating commonly known infections. In an ideal situation, for a typical infection, we use antibiotics and they work very well. But as antibiotic resistance increases, the same antibiotics are not able to treat those infections very well. And what happens is that infection can actually spread into the community, requiring more antibiotics, requiring more other medications, and giving a lot of burden to the person who's infected and also to the community and also to the country that they live in. In Nepal, antibiotic resistance is actually increasing, whether it's typhoid, whether it's pneumococcal infection, or the very lethal tuberculosis infection. We know a lot of multi-drug resistance is seen in tuberculosis. Extremely high level of resistance is seen in tuberculosis bacteria or germ. So we are facing a very major problem. It's a major threat to the population. And with that, what happens is the individual has to face a lot of pressure, financial and otherwise. The community faces the pressure, and the healthcare, which is already under pressure from various aspects, faces pressure in Nepal. So with the fact that the antibiotic resistance is increasing, we are expecting a lot of problems into the future. Vaccines are very important in controlling AMR or antimicrobial resistance. What vaccines do is to control the spread of infections or spread of germs in the community. And when the infections are controlled, there's no need to take antibiotics because the people simply are not very sick. So therefore, the importance of vaccine, especially in a country like Nepal, is profound. Nepal suffers from burden of limited health care, also limited economy. People have financial constraints in the country, and especially in a country like Nepal. Therefore, we must push vaccines. Two examples of vaccines already impacting the community are pneumococcal conjugate vaccines, or we call them PCV, or typhoid conjugate vaccine, TCV. Those have been introduced in the Nepali population for children, and after having been introduced, those have helped control the spread of disease, the spread of those two diseases in the community. And now the use of antibiotics in those communities is coming very low, going down. Similarly, if we could now introduce cholera vaccine in the community, we could see similar results because cholera impacts a lot of people in the community, and having a vaccine might lead to reduced antibiotic use in those diseases.